The paramedic checked my pulse and wouldn't let go. I never thought I'd find comfort in the grip of a stranger, but that's exactly what happened on a rainy Tuesday morning last October. The day had started like any other: alarm clock, coffee, commute, until the moment my world tilted sideways and everything familiar dissolved into a blur of sirens and urgent voices. It's strange how life pivots in an instant, how the mundane transforms into the extraordinary without warning or permission. Let me take you back to that morning, to the moment when a paramedic's hand around my wrist became my lifeline in more ways than one. I had been feeling off for a few days, a persistent headache, occasional dizziness, nothing that seemed worthy of medical attention. Just push through it, I told myself. We all do that, don't we? Convince ourselves that our body's warning signals are mere inconveniences to be ignored in favor of deadlines and obligations. That morning, standing in line at my favorite coffee shop, the warning became impossible to ignore. The room began to spin, voices around me muffled as though I was underwater, and a crushing pressure spread across my chest like a vice tightening with each heartbeat. "Are you okay?" someone asked, their face swimming in and out of focus. I tried to respond, but my words slurred together, and I felt my knees buckle beneath me. The last thing I remember before everything went dark was the cold tile against my cheek and the distant sound of someone calling for help. When consciousness returned, it came in fragments: the ceiling of the coffee shop, concerned faces peering down at me, and then, most vividly, the firm grip of a hand around my wrist. That hand belonged to a paramedic named Michael. I would learn his name later, but in that moment, he was simply the calm presence in the eye of the storm that had become my morning. "I'm checking your pulse," he explained, his voice steady and reassuring. "Just breathe with me, okay? Nice and slow." His grip was professional but gentle, his fingers positioned precisely over the veins where my life force made itself known in rhythmic beats. What struck me wasn't just his technical proficiency, but how he maintained eye contact while counting silently, as if he was communicating directly with some essential part of me that existed beyond words. Let me explain why this matters. In moments of crisis, we often focus on the dramatic elements: the sirens, the medical equipment, the urgency. But sometimes, it's the simplest human connections that anchor us. That point of contact, his fingers on my wrist, became the focal point of my entire existence. Through it, I could feel my own heartbeat, erratic at first, gradually steadying under his watchful attention. It was as if he was not just monitoring my pulse, but somehow helping to regulate it through sheer force of will and professional competence. As my awareness expanded beyond that single point of contact, I began to take in more of my surroundings. The coffee shop had cleared except for the staff and a few bystanders who couldn't tear themselves away from the drama unfolding on their morning coffee run. Another paramedic was setting up equipment, communicating with Michael in the shorthand of medical professionals. A woman who identified herself as the manager hovered nearby, clutching my spilled coffee cup as if it were evidence in a crime scene. "Your heart rate is elevated, but stabilizing," Michael informed me, still maintaining his grip. "Can you tell me your name and what day it is?" I answered correctly, though my voice sounded foreign to my own ears. He nodded, satisfied, but didn't release my wrist. Instead, he shifted slightly, adjusting his position to take my blood pressure with his free hand, a feat of dexterity that spoke to years of practice. All the while, his fingers remained wrapped around my pulse point, as if he feared that releasing it might cause my heart to forget its rhythm. In those moments, as I lay on the floor of a coffee shop I'd visited hundreds of times before, I experienced a vulnerability so profound it was almost transcendent. We go through life maintaining the illusion of control, of independence. We convince ourselves that we are self-sufficient islands, needing no one. But there I was, utterly dependent on this stranger who held my pulse in his hands. The thought should have been terrifying, but instead, I found it oddly comforting. There was something deeply human about surrendering to the care of another person, about acknowledging my own fragility. The second paramedic, Lisa, I would later learn, attached monitoring equipment that would do the job Michael's fingers were doing, but still, he didn't let go. "Your EKG looks relatively normal," he said, studying the readout. "But your blood pressure is concerning. We're going to take you to the hospital for further evaluation." I nodded, feeling a surge of fear at the word hospital. As if sensing my anxiety, Michael's grip tightened slightly, not in a clinical way, but in a gesture that felt almost like reassurance. "Have you been experiencing any symptoms before today?" he asked, maintaining that steady eye contact that somehow made it impossible to look away or to lie. And so I told him everything: the headaches, the dizziness, the moments of disorientation I'd dismissed as stress or lack of sleep. As I spoke, I watched his expression change subtly, his professional mask slipping just enough to reveal concern. "Why didn't you seek help sooner?" he asked, not accusatory but genuinely curious. It's a question I've asked myself many times since. Why do we ignore the warning signs our bodies give us? Is it denial? Stubbornness? Or something deeper, perhaps a fundamental unwillingness to acknowledge our own mortality? I didn't think it was serious, I admitted, the inadequacy of the answer hanging in the air between us. Michael nodded, understanding in his eyes. He'd heard this before, from countless patients on countless floors, all of us believing ourselves invincible until proven otherwise. They prepared to move me to the ambulance, a process that involved a stretcher and more hands than seemed necessary. Throughout the transition, Michael maintained his hold on my wrist, adjusting as needed but never breaking that connection. It occurred to me that this might be standard procedure for someone in my condition, but something in the intentionality of his grip suggested otherwise. It wasn't just about monitoring my vital signs anymore. It had become a tether, a human connection amid the clinical chaos. In the ambulance, the rhythm of the road beneath us created a strange sense of limbo, no longer in the place where I'd fallen, not yet at the hospital where answers awaited. The siren wailed intermittently, a sound I'd heard countless times from the outside, but never from within. It's different when it's for you, when you're the emergency that can't wait. Lisa worked efficiently around us, adjusting equipment, radioing ahead to the hospital. Michael remained at my side, one hand still on my wrist while the other operated equipment and made notes. "You're doing great," he assured me, though I wasn't doing anything at all except lying there, existing, my body simultaneously betraying and fighting for me. "Just keep breathing normally," as if I had any control over that. But his words had a strange power. They made me feel like an active participant in my own rescue rather than a passive victim of circumstance. I focused on my breathing, on the sensation of his fingers against my skin, on staying present despite the fear threatening to overwhelm me. Time became elastic in that ambulance, stretching and contracting in ways that defied the clock. What was probably a 15-minute journey felt both eternal and instantaneous. Throughout it all, Michael talked to me. Not just the professional questions about my medical history and symptoms, but real conversation. He asked about my job, my family, the book I'd been reading before all this happened. Later, I would recognize this as a technique to keep me alert and assess my cognitive function. But in the moment, it felt like genuine interest, like he was seeing me as a person rather than just another medical emergency. "We're almost there," he said eventually, and I felt a surprising twinge of regret. As terrifying as this experience was, there was something comforting about the contained world of the ambulance, about the certainty of Michael's presence and the constant pressure of his fingers on my wrist. The hospital meant more unknowns, more strangers, tests and procedures I couldn't anticipate. As if reading my thoughts, Michael leaned closer. "I'll stay with you through the intake," he promised. "Make sure they have all the information they need." The hospital arrival was a blur of motion and noise. Automatic doors sliding open, fluorescent lights harsh after the dim interior of the ambulance, voices calling out information in that rapid medical shorthand. I was wheeled through corridors, past other dramas unfolding in curtained bays, to a room where more monitors awaited. True to his word, Michael stayed beside the stretcher, his hand still maintaining that connection to my pulse even as he efficiently transferred information to the hospital staff. It wasn't until a doctor approached, introducing herself and beginning her own assessment, that Michael finally released his grip. The absence was startling, a cold spot on my skin where his warm fingers had been. He stepped back, professional boundaries reasserting themselves now that I was safely delivered to the next level of care. But before he left, he leaned down once more. "You're in good hands now," he said quietly. "Remember to advocate for yourself. Tell them everything you told me." As he turned to leave, I felt an unexpected surge of panic. This person who had been my anchor for the past hour was walking away, back to his ambulance, on to the next emergency. "Michael," I called, surprising myself with the urgency in my voice. He turned back, eyebrows raised. "Thank you," I said, inadequate words for what I was feeling. For not letting go. Something flickered across his face, recognition, perhaps, that what had transpired between us had been more than just standard medical care. He nodded once, a small smile softening his professional demeanor. "Take care of that heart of yours," he said simply, and then he was gone, leaving me to face the next chapter of this unexpected journey. The doctors would later tell me I had experienced a TI, a transient ischemic attack, sometimes called a mini-stroke, a warning shot across the bow, a preview of what could happen if I continued to ignore my body's signals. The diagnosis was frightening, but also a relief. It had a name, a treatment plan, a path forward. As I lay in the hospital bed that night, monitoring equipment beeping softly in the background, I found myself repeatedly touching my wrist where Michael's fingers had been, as if trying to recapture that connection. The human touch has healing properties that science is only beginning to understand. Studies have shown that physical contact can lower blood pressure, reduce stress hormones, and even boost our immune systems. But beyond these physiological benefits, there's something more profound at work, something about the way touch bridges the gap between isolated consciousness, reminding us that we are not alone in our human experience. Michael's grip on my wrist had been clinical, yes, but also deeply human, a lifeline in the most literal sense. In the weeks of recovery that followed, I found myself thinking often about that morning, about the strange intimacy of crisis. We tend to move through life maintaining careful distance from strangers, protecting our personal space and our emotional boundaries. Yet in moments of emergency, those boundaries dissolve. We surrender ourselves to the care of others not just out of necessity, but out of a primal recognition of our shared humanity. There is both vulnerability and strength in that surrender. The experience changed me in ways I'm still discovering. I'm more attentive to my body's signals now, more willing to acknowledge my own limitations. But the change goes deeper than just health precautions. I find myself more aware of the connections that sustain us, the invisible threads that bind us to one another in moments both ordinary and extraordinary. I'm more conscious of my own hands, how they reach out or withdraw, how they might serve as anchors for others in their moments of need. 3 months after my hospitalization, I returned to that coffee shop for the first time. The staff had changed, and no one recognized me as the person who had collapsed on their floor. I ordered my usual and sat at a table, watching the morning crowd in their familiar dance of caffeine acquisition. Across the street, an ambulance idled at a red light, its lights off, no emergency in progress. I wondered if Michael might be inside, heading to or from a call, his skilled hands ready to reach out to someone else in crisis. I never saw Michael again, though I did write a letter of appreciation to the paramedic service, mentioning him by name. I don't know if he remembers me. I imagine paramedics see too many patients to recall each one clearly. But I remember him, and specifically, I remember his hands, steady, competent, and kind. Hands that held my pulse and, in doing so, held something more essential about me. We talk often about life-changing moments, about the big decisions and dramatic turning points that alter our course. But sometimes, the most profound changes come from the simplest human connections, from a stranger who holds your pulse and won't let go, who sees you not just as a medical emergency, but as a person worthy of care and attention. In a world that often feels disconnected and cold, these moments of genuine human contact remind us of what matters most. So I leave you with this thought. We are all, in our way, holding each other's pulses, responsible for one another in ways both seen and unseen. The next time you reach out to touch someone, a handshake, a hug, a comforting hand on a shoulder, remember the power in that connection. Remember that you might be the anchor someone needs in their storm. And if you find yourself in need of an anchor, I hope there's a Michael for you too, someone who knows exactly when to hold on and how to let go. Total_char_count, 13,476.